Y'all know me, I'm Dr. B, and this is The Buzz on pinworms. Last week we talked about ringworm, which you learned is not a worm at all, it's a fungus. This week let's talk about an actual type of worm, pinworms. Pinworms are very common in kids and they're very contagious. Even adults can get them if they don't keep their hands clean. But fortunately, this problem is not really dangerous. But they are common, especially in school-aged kids. And since school is just coming in again, let's talk about their life cycle and what we need to watch out for. This is the life cycle of Enterobius vermicularis, the human pinworm. Like the proverbial chicken and egg, we could start with either the worms or the eggs. But let's start it up at the top left, number 2. That's an egg that's being ingested or eaten by a human, hopefully accidentally, and it goes down into the stomach, and those eggs hatch in the small intestine, and as the worms mature, they move down to the cecum, which is the first part of the large intestine where the appendix is. And there the males and females mate, and the female gets pregnant and continues on her way. This is actually an adult pinworm inside someone's large intestine. This was taken in an adult human during their colonoscopy, and they happened to find some pinworms in this patient who they apparently were not looking for pinworms, but they found them. So as this pregnant female moves down into the lower part of the large intestine, this part sounds kind of gross and like a bad sci-fi movie, but she crawls out of the anus at nighttime and crawls around on the skin and lays eggs around the perianal area. And that causes itching. And this is why the classic symptom of pinworm infestation is perianal itching, or itching around the anus at nighttime. In a few hours, these eggs are mature and ready to cause another infection, and then that moves on to the next person. So what happens, the way that people pass this on, is that if the kid scratches their bum, gets some eggs, some pinworm eggs on their fingers or under their fingernails, and then they chew their fingernails or stuck their thumb, they can reinfect themselves. Or if they take their dirty fingers and they touch a surface with those dirty fingers, and they can pass it to another child that way who also enjoys chewing their fingers, and so on and so on. As far as adults getting this, a parent or a daycare worker may change the infected kid's dirty diaper or clean up after them in the bathroom. Maybe they don't wash their hands well, and then they eat a sandwich or eat something with their fingers or chew their own fingernails because they're adults who chew their fingernails. Then something of that nature happens, and then the eggs get back in and the cycle starts all over again. So this is highly contagious, especially in school-age kids and their parents or their caretakers. In fact, it is the most common intestinal parasite worldwide. As we said, an itchy booty area at night is the classic symptom of pinworm infestation, but it may not always be that obvious. The child may just be uncomfortable or restless at night. It may interrupt their sleep cycle. They may be irritable during the day due to lack of sleep. And also, it may not just be around the anus, but the vaginal area can be itchy as well in some females. So consider that when your daughter might be itching or scratching at themselves, even from the front. There really aren't any other common overall or systemic symptoms. So if your child has weight loss or chronic diarrhea and bellyache or blood in the poop, we really need to think about other diagnoses other than pinworms. Now, in the office, we do diagnosis usually based just on the history, and if there are any other cases in the community, that helps us as well. Because very often we don't see anything on exam other than maybe a little bit of irritation around the booty if they've been scratching themselves. We do have to look at the bum and make sure there's not something else glaringly obvious there that might be causing them to be itchy around the booty hole. Rarely, you may see adult worms on the outside of poop. And I know this picture is pretty gross, but we're all adults here. And here's what they look like. This is some baby poop. And yes, part of the glamour of medicine is looking at poop on the rig. But anyway, the worms look like tiny little white threads, maybe up to a third or a half inch in length at the most. And they're very thin, very hair-like. More often you can see these worms around the anus at nighttime. If you go in there with a flashlight and take a look, you might see some of these whitish threads around the anus. Now, if you really want to get scientific about it, you can do the Scotch tape test, where you apply Scotch tape to the anal area first thing in the morning before the child wipes themselves or before they take a bath or use a bathroom or anything like that. The official way to do this is first thing in the morning, 3 days in a row, and bring that to your doctor. And they'll look at it with a microscope to look for eggs or worms. And you can see, if we go close up on this picture, you can actually see a little worm there right on the slide. This is a microscopic look at a piece of Scotch tape, and you can see all those eggs on there. They make a lot of eggs, and this is another reason why they're so contagious. The good news about pinworms is that, well, not only is it not that dangerous, but the treatment is over the counter. The first line of treatment that we usually recommend is called pyrantel pamoate, and you can get that just about anywhere. It's a single dose, and the child can go back to school after being on this medicine for 24 hours. The dose should be repeated after 2 weeks to prevent the child from being reinfected. And I recommend everyone in the family should be treated, if possible, if there's no reason not to, because sometimes this will be asymptomatic in people. They won't have any symptoms of it or no obvious symptoms, and they're going around carrying pinworms. There's a liquid form, there are chewable forms. It's over the counter. Follow the instructions and you shouldn't have any problem with it. It shouldn't be any side effects. This medicine, amazingly enough, also treats other types of worms like roundworms and hookworms. Works on those pretty well, so this is a nice little benefit. There are prescription medications we can use for pinworms, including mebendazole and albendazole, but the over-the-counter medicine, the over-the-counter pyrantel, should work just fine. After treating with pyrantel, there is a slight chance that you will see some extra worms come out in poop in the next day, but they're very small and they're very fragile, so usually we don't hear about this. The only thing that happens is the child stops itching and everyone feels a lot better. Most importantly, how do we prevent pinworm infection and reinfection? Hand washing and good hand hygiene is absolutely key. Hand washing after using the bathroom and before eating to make sure we don't have any eggs on our skin. Do not chew fingernails. Keep the nails short and clean. Have the kids brush under those with an old toothbrush with some soap. Do not suck on the thumb or put fingers in the mouth. Do not scratch your butthole. Can't recommend that enough for many reasons. Daily bathing is a great idea. If there's been pinworms in the house, morning bathing is probably the best idea. Frequent changing of the underwear and linens and PJs, washing those in hot water. Regularly clean household surfaces. These eggs can live on surfaces for 2 to 3 weeks. So make sure you clean any areas where the kids play a lot, especially clean any diaper changing areas, clean the bathroom, so we make sure we don't pass this on. In summary, pinworms are not a dangerous problem. They're just kind of gross, they're kind of annoying, and they spread far and wide very easily. They can actually run through daycares and through schools. You can diagnose and treat this safely yourself at home, however, and prevention includes mostly just keeping your hands clean and out of your mouth and keeping surfaces clean. Complications from pinworm infestation are usually pretty rare. However, if your child is not getting better, if they keep getting this kind of itchy bum a lot, or if they have symptoms beyond itchy bum like weight loss or blood in the stool or poor appetite or something like that, then please let your doctor know, or if you're my patient, then please let me know, because we're going to want to see that patient in the office and take care of this in the most appropriate way. I just want to say thanks to everyone. We just passed 1,000 subscribers. Very excited about that. It was kind of my benchmark. Hey, if we can get to 1,000, that's going to be pretty amazing. So thanks to everyone who has liked and subscribed and shared this. Please like, subscribe, and share if you haven't already. And let me know in the comments below what you want to see, what you'd like me to go over. Y'all know me. I'm Dr. B. You can talk to me anytime. And this has been The Buzz on Parenting and Pediatrics. We'll see you next time.